This video continues Chapter 23 of OEC 6, Chest Trauma, and in this video we'll take a look at the major anatomic structures of the chest cavity, keeping in mind that the thorax contains vital organs from both the cardiovascular system and the respiratory system. Therefore, some of the injuries that may occur to the thorax will be significant. When we look at the anatomy and physiology of the chest, we can consider that the thorax extends from the base of the neck to the lower edge of the rib cage, and the diaphragm will separate it from the abdominal cavity. The entire thorax is encased with ribs on the front side, the sternum, the bony center of the chest at the front, and in the back we have the vertebrae and the scapula providing protection and structure to all of those key organs. Once again, the chest cavity contains organs of both the respiratory system and the cardiovascular system, and anatomically the heart lies near the center of the chest, and between the lungs above the heart we have the mediastinum, and the mediastinum is where we would find the heart, the aorta, the vena cava, and the distal portion of the trachea. Now the diaphragm is the bottom part of the thorax, separating the thorax and the abdominal cavities. Now, one thing to consider is that the diaphragm is controlled by two phrenic nerves connecting to the spinal cord at the cervical vertebrae, numbers 3, 4, and 5, and so injury at or above this level can impair respiration because it will affect the function of the diaphragm. We see that described here. C5 and C6 in particular, respiratory arrest will occur if the spinal cord is completely transected, that is, cut, at a level above C3. Now, additionally, the thorax contains two adjacent membranes called pleura, one for each lung that we have. Between those membranes, which are just sacs surrounding the lungs, there is a clear or serous fluid that acts as a lubricant, allowing the lungs to move freely during inhalation and exhalation. If trauma allows air or fluid, such as in a pneumothorax or a hemothorax, to fill that space, it can collapse the lung, reduce its volume, and create breathing problems. Likewise, the heart is contained within a sac. It's called the pericardium, literally around the heart. And again, it has lubricating fluid allowing the heart to move with each beat, but that sac does not have a lot of give. Little space exists between it and the heart, and so if fluid or blood accumulates within the pericardium, we can compromise heart function, we can allow it to not pump completely during systole, and we end up with pericardial tamponade. One thing unique to the thorax or the chest cavity is that its size changes during each breath as the diaphragm contracts or we use accessory muscles. When a person is lying supine, the diaphragm may rise as high as the mid-nipple line. What appears to be a chest injury by the external location of the wound may be an abdominal injury because of the rise of this diaphragm.